We have 204 communities, we've got 34 language groups. We are all not the same, but we do have the similar issues that we face all the time. And so that's why we need an overarching framework to work from. A principles document on legislation would do that. It's not prescribing what the solution is, it's saying these are the things that government needs to interact with us on to ensure that our people get equitable service, get accessible service. And when you do framework documents, it sets us through the direction for the next 10 years. It's not sort of just one and done, it's a process where we're just ever evolving like the 7 directives.
The Health Council's not drafting legislation, the Health Authority is not drafting legislation. This is an initiative from Canada, an initiative from British Columbia. But engaging with our communities and our leadership to ensure that they have a say in what the principles are that will be utilized for the creation of that legislation, I think really speaks to the heart of ensuring that we're community-driven, nation-based. Now is the time to return to the table and ensure that we're meeting those original objectives that the leadership set for us.
In doing this work, that engagement pathway is how we get to see the chiefs and leaders in each community, and we bring them together for that conversation. And we put forward to them the information, we hear from them, we report back to them, we revise it. It's a whole process in itself. And we saw very clearly that at this gathering wisdom, we wouldn't have the information chiefs and leaders need to make informed decisions about where we needed to go. And so we extended the engagement pathway.
Priorities for any type of provincial or federal health legislation, what I have heard from chiefs and leaders is that we need to see zero tolerance for racism across the board. Our people deserve and need equal access to health care, regardless of where they reside, whether it be in a rural and remote community or whether it be downtown East Vancouver. British Columbia is the first and only province or territory in Canada that has taken over our healthcare services for First Nations peoples, and that needs to be acknowledged in any health legislation.
First Nations want to be putting in their perspectives and their values and principles. And I find that the process has a lot of value, and then it also has a lot of challenges and where it can create barriers for people as well. Understanding what the legislation means to begin with, and then also how that legislation communicates with the tripartite agreement, and then how each region has their own governing terms of reference and practice. But I think we're on our way to understanding how we could better align those principles.
Our First Nations people want to be a part of lawmaking. We are in the time of DRIPA and UNDRIPA, and we know and we fully understand that as First Nations people, we need to be at the table. I have also heard that many of our First Nations across the province have different capacities to be a part of lawmaking, and BC and Canada need to understand that and need to ensure that all of our First Nations are included when it comes to lawmaking.